we are confirming the new paradigm in approaching angioedema, which consider as the main goal to reduce the number of the attacks and to improve quality of life of patients. Thus, at the same time, we can propose long-term prophylaxis in patients with several attacks, monthly attacks, or with a high monthly attack rate. But anyway, no LTP is fully effective. Thus, both patients only on-demand treatment, as well as those patients who undergo long-term prophylaxis, need acute treatment available, and they use on-demand treatment. But what we are emphasizing with our patients, and obviously as a result of the guideline, is that to make more effective the treatment, you have to treat as early as possible the attacks. That means treating at the onset of the attack, because we know that if there is a delay between attack onset and treatment, the drug will be less effective and will not be so effective in reducing both the severity and the duration of the attacks. Thus, treating early is the main concept of the guideline. Obviously, in the past, we had only injectable drugs only for on-demand treatment, and this resulted in the delay of treatment because patients needed to find a quiet room, an appropriate room where to treat. They have to prepare the serum, the drug, to inject, and so on. And thus the new innovative clinical trial planned the possibility to treat on demand with oral tablets. That is the only way to allow patients to treat as soon as possible. And we are now motivating the results from clinical trial into real life. Yes, the KONFIDENT trial has been the pivotal trial, clinical trial, which allowed the approval of this drug, firstly by FDA and then also by EMA. The result has been very interesting because there has been a reduction in the interval between one set of symptoms and treatment compared with previous available treatment that were only injectable. And these results in a very, very quick response to treatment with the end of the progression of the attack and also the initial phase of the remission, because the first step is to stop the progression of the attack, and the second one is to have an improvement in the symptoms. And you can reach both this outcome by treating as early as possible. And this is what it happened with the KONFIDENT trial. And we have data from open label extension trial, of course, studies, that this delay is shorter in real life if we compare with the pivotal trial, with KONFIDENT trial, because patients became really confident on the drug, about the drug. They know that the drug is easy to carry on, is easy to take, it allows a very, very fast response, and they treat earlier than in a clinical study now. Now is less than 10 minutes. That's not a delay. It's really an early treatment, because you have to 10 minutes is the time you required to recognize that an attack is happening. If we consider any kind of guideline consider at the same level as first-line therapy all the drug that had been approved by regulatory authorities. And it should not be, it might not be different, of course, because all the drugs showed to be effective and safe. If not, they would never been approved by authorities. But anyway, we consider that sebetralstat, and this is the reason that sebetralstat is the only drug to maintain the status of orphan drug by EMA. Orphan drug means that the drug is covering an unmet need for patients. It maintained the status of orphan drug because it changed, not because just oral compared with injectable, but because having the opportunity of an oral therapy really change the approach of patients to yearly treatment, and patients treat really early, not only in the clinical study, but also, that's not important, in real life. And this is the reason that even though guideline weight with the same weight all the drugs, we think that oral therapy might change the life of patients and increase their adherence to more recent guidelines.